Hi all, my name is Emelina. My grant proposal is exploring patterns of frequent flyers among patients with chronic diseases. I would like to propose this research on healthcare utilization patterns among patients with chronic diseases who are frequent flyers, basically in and out of the hospitals and the ER rooms. Chronic diseases that often lead to frequent hospital visits include diabetes, hypertension, kidney disease, chronic pain. These conditions require ongoing medical attention, and patients with these diseases may experience increased hospital admissions. Um, my proposal is remote monitoring can help with managing these conditions to reduce hospitalizations and improving patient outcomes. So, the objective of this proposal is to investigate healthcare utilization patterns among patients with chronic diseases and to identify factors associated with frequent hospitalizations and emergency department visits. So the data collection methods used are medical records and virtual interviews. Um, so we can discuss medical records first. These are the advantages: rich source of existing data, reduced participant data, allows for longitudinal analysis and identification of patterns over time. Disadvantages are data quality and completeness that may vary, and access to medical records can be time consuming due to obtaining consents to utilize data. So we want to use medical records because what we do utilize these medical records, the data can provide us with quantitative data on healthcare utilization patterns. We can see how frequent participants are admitted to the ER, or when they're admitted as inpatient, we can see the diagnosis found and the doctor's notes. So virtual interviews, advantages are that it allows for in-depth exploration of participants' experiences and perceptions, the increased flexibility and accessibility for participants. Disadvantages are technical issues such as internet connection or people aren't as always tech savvy. And it also may require additional resources for transcription and analysis. So when we utilize virtual interviewing, it offers qualitative information from participants' real life experiences and perceptions. So some ethical concerns are confidentiality and privacy and informed consent. So we will need to ensure that all identifiable information is removed from medical records and review transcripts. Participants need to provide informed consent before participating in any interview. We also will clearly explain the purpose and procedures of the study to participants to ensure that they understand their rights and responsibilities. So the budget breakdown for this study, it's approximately 50,000. Um, and this is how we plan to allocate these funds. Here's a pie chart of the budget allocation. So 67% of the cost will go towards the personal costs, which includes private investigator and research assistants. 20% of the cost includes the incentives that we have for participants in the form of Visa gift cards. 10% are the equipment costs, which are the computers that we need for the private investigators and research assistants. And 3% of the budget is for the softwares that we will use, which includes the Zoom for the video interviews and SPSS software to analyze the trends. So, in conclusion, our study on healthcare utilization patterns among patients with chronic diseases highlights the importance of understanding the complex factors that can influence healthcare outcomes. So, when we combine medical record reviews and virtual interviews, we can gain a deeper understanding of the challenges that are faced with these patients of chronic diseases and identify opportunities for improvement. So let's work together to improve healthcare outcomes for patients with chronic diseases. Join the effort to improve healthcare outcomes. Thank you.